Hello, it's Shelly and Brenda.
Hi.
Welcome to video number 4. We're going to talk about THC. Delta 9 tetrahydrocannabinol is known in the short form as THC. THC is one of several hundred chemical compounds found within the cannabis plant.
Of the several hundred different chemical compounds found in the cannabis plant, over 100 of these chemical compounds are called cannabinoids. THC is the number one major cannabinoid.
THC is the intoxicating component of cannabis. THC may cause feelings of euphoria or make you feel high. With that being said, the side effect of euphoria can be somewhat managed by adding CBD. If THC is indicated, our program will use a balanced dose of THC and CBD. If you choose to use THC, it may not be safe for you to use during working hours.
There are hundreds of different strains of cannabis. Jack Herer, Berry White, and Mango Kush are some of the popular THC strains. You may need to try several different strains before finding the right one that works best for you.
In addition to the strains, there's 3 classifications or categories of strains. They are as follows: sativa. The sativa plant grows tall with thin leaves, said to be uplifting, may increase focus and creativity, therefore they tend to be used in the daytime hours. The indica plant grows shorter with bushy leaves, said to be relaxing and calming, therefore we use them in the evening or bedtime hours. The hybrid plant is a combination of both the indica and the sativa. However, there is much debate on the differing effects, if any, with these different classifications.
With that being said, due to man evolving the cannabis plant over the centuries, strains are no longer pure sativa or pure indica. 99% of strains are actually now considered hybrids. Presently, strains are described as indica dominant, sativa dominant, or a hybrid, which is approximately 50-50. Sativas are known, but not always, to have a higher THC content.
It's important to remember that THC is not a cure, but is used for symptom management. THC is most commonly used to reduce neuropathic pain, induce relaxation and sleep, reduce nausea associated with chemotherapy, and increase appetite, and reduce the use of opioids.
Even though people choose to use THC, Health Canada does not endorse the use of cannabis for medical purposes. This is one of the biggest risks of taking THC, as the scientific community does not know all the possible risks, side effects, or drug to drug interactions.
Anecdotal side effects include, but are not limited to, fatigue, drowsiness, dizziness, sedation, euphoria, fast or slow heartbeat, anxiety, agitation, paranoia, hallucinations, impaired memory, amnesia, changes in appetite and weight. Other side effects may occur as each individual response is based on age, sex, health, chronic illness, genetics, and other medications you may be taking.
We ask that you monitor for any health changes and side effects. Monitoring your blood pressure and heart rate is especially important if you're taking any heart medications. Keeping a daily diary may be beneficial.
Drug to drug interactions may occur with THC. A thorough medication review will be done on initial assessment. When starting any new therapy, it's best to start when you're at home and to have someone you trust with you.
THC is not covered by OHIP or most insurance companies. The average cost of therapy is $150 to $200 per month. If you cannot afford medical cannabis, this therapy option unfortunately is not for you.
THC is available in oil form, whether you use a dropper or a syringe, sprays, capsules, dry bud, and topical lotions. THC is dosed based on your reason for use, your individual response, and tolerance or side effects.
When starting THC therapy, you will start at a low dose and will increase the dose slowly. Starting low and slow allows you to adjust to any side effects that may occur.
Since we start low and go slow, it may take days to weeks for you to feel any positive effects. Occasionally, it may even take a couple of months, especially when we may have to change strains to find the one that works best for you.
THC can be psychologically addicting, with 1 in 10 people becoming dependent, resulting in cannabis use disorder. You may even become tolerant to it, eventually needing a higher dose. We closely monitor for symptoms of cannabis use disorder and may have you take a drug holiday if tolerance develops, keeping you safe from harm.
The maximum dose of THC is approximately 210 milligrams per day. Most people benefit, though, from a dose as low as 2.5 milligrams to 60 milligrams per day, with an average dose roughly around 20 milligrams. Lower doses will avoid the incidence and risks of adverse effects.
Alcohol should be avoided if using THC products, as using these in combination may worsen side effects. Furthermore, smoking cannabis while consuming alcohol has resulted in irregular heart rhythms and heart attacks.
In addition, central nervous system depression may occur when combining THC with alcohol and with other medications such as opioids, benzodiazepines, and barbiturates. A deprescribing program may be recommended for you. We are very successful in reducing or eliminating some of these other medications.
There is some evidence that heavy cannabis use is linked to testicular germ cell tumors. If you are a man who wishes to start a family, then cannabis therapy may not be your best option.
And if you're a female planning to get pregnant, are pregnant, or are breastfeeding, then THC is not a therapeutic option for you. THC is known to affect a woman's ability to get pregnant, affects the baby's developing brain, results in lower birth weight and lower alertness, and cannabis does pass into the breast milk.
With all the downfalls of THC, one of the best benefits is there is no lethal dose. One research study administered a dose of 9,000 milligrams per kilogram to a monkey, and the monkey survived. With the ongoing opioid crisis, medical cannabis could potentially reduce mortality, improve pain management, and ultimately reduce healthcare costs.
Yeah, so I wanted to touch on this because this is really interesting. So, the reason why that there's no lethal dose of THC is that in our endocannabinoid system that we will be talking about in the next video, we have no receptors for cannabis on our breathing center. Opioids, they do have a receptor on our breathing centers. So, therefore, it's easier to overdose on an opioid. You cannot overdose on THC. You can take too much where it may make you feel paranoid and have hallucinations, but there's no lethal dose. Like it cannot kill you directly versus an opioid. So they are safer when you're looking at it in that aspect. Okay. So, with that being said, how do we dose? So, we dose THC based on, of course, your reason for use, as well as considering the pharmacokinetics with onset, peak, and duration of action. So, THC oil, sprays, capsules, and dry flower, when taken orally, are very similar in the onset of action, roughly about 30 to 90 minutes. They may peak anywhere from 2 to 4 hours, and they may last anywhere from 4 to 24 hours, depending on the person.
However, the dry flower or bud taken by inhalation is different, with an onset of 5 to 15 minutes, peaking at 20 to 30 minutes, and a duration lasting from 2 to 6 hours. Inhalation therapy is only ordered if immediate onset of action is needed, such as in palliative care and anxiety panic disorders. We use caution with inhalation therapy, as this may place you at risk of developing lung disease. With this being said, if you are already smoking cannabis, vaping is then suggested as a harm reduction approach.
THC therapy has a wide dosing range. We typically start a dose as low as 0.05. So if you take a look at the syringe, so half of the one, so 0.05, so like literally maybe a drop, okay? Depends on the person. We may go all the way up to 0.25, just like we do with CBD. Anyway, we do once a day dosing. We usually start it at bedtime just so that way you don't feel any side effects. We will adjust the dose based on your individual response and tolerance. It is best to be taken with food as it is lipid binding.
One of the biggest questions asked is, does it work? Most patients say that it has changed their lives for the better or that the side effects outweigh the benefits. You won't know how it will affect you until you try it.
And this concludes video 4, Delta 9 Tetrahydrocannabinol. Thanks again for being with us. You may now proceed to video 5, titled The Endocannabinoid System. Thanks again.
Thank you.